Hello, and welcome back to my video. This week I wanted to talk about kind of a new program that we're developing in my current company that I think pertains to social work a lot, which would be this model of collaborative care. Um, so basically what collaborative care is it's a collaboration of a client's PCP, so their primary care physician, typically a clinician, so like a social worker, and then a psychiatrist. And what this model does is specifically related to my company is that clients will go to their PCP and the primary care physician will notice that there's some sort of behavioral health issue. Maybe they come in tearful or there's substance use or fatigue, but he thinks it could be related to a mental health issue. Then he will put in a referral for behavioral health, which will be linked to my company. So then we'll kind of step in. So the social worker will reach out to the client, explain our services, and basically the overall goal is to integrate behavioral health into the primary care setting where it typically wouldn't be. PCPs have a lot of time they have a lot less time to manage patients with behavioral health. They have patients to see. They don't have time to do like proper intakes and assessments on these patients. So what this does is it takes that burden off the primary care and kind of puts it onto the social worker, which they are trained to do. So just like a typical workflow kind of would be the PCP refers the patient, the social worker reaches out to the patient, completes an assessment. This scores, these assessments are like PHQ-9, which scores for depression, G87, it scores for anxiety. We also have some substance abuse scores and general living questions like do you have housing, do you have access to food, etc. And what the social worker does is conducts an intake. So they will speak to the client for about an hour to 2 hours. They'll gather all pertinent information about their family history, their psychosocial history, timeline of symptoms, meaning what led up to them go to their PCP office in a tearful state. They gather all their current medications they're on, their allergies, their current medical problems, and then they gather medications because we like to see what type of psychiatric medications they've used in the past, if any, and what's worked, what hasn't worked. They'll gather information like past treatment. Have they ever been hospitalized before? Have they seen a therapist before? Did it work? Did it not work? So all that pertinent information. And then what the social worker does, which is also known as the clinical care manager, is they take all that information and relay it to a psychiatrist. And then the psychiatrist will provide medication recommendations, treatment suggestions. The interesting part about my program is it's all virtual, so the patient never sees or hears from the psychiatrist. The social worker is the only person that the patient and the PCP talk to. The psychiatrist is kind of like a consult who is outside of the program. And the benefit of this would be it's kind of like population health, so it takes the time out of people who with severe mental illness who need to see that psychiatrist in person. It takes the person that I would be working with out of that wait time so other people with more severe mental illness can be seen. So then the psychiatrist will collaborate. It's all collaboration. Will collaborate with the social worker on that intake that they got from the client. They will alter their medication or suggest altering their medication if that makes sense. They will provide treatment suggestions such as find patient a therapist, etc. And then what the social worker will do is then take all that information and relay it back to the PCP, and then the PCP will actually be the one prescribing the new medication if there's any recommended, and talking to the patient because it's still their patient, talking to the patient about those recommendations, and then the social worker kind of facilitates in helping the patient follow those directions, make sure they're scheduling their appointments, make sure they've gotten their new medication that the PCP recommended, that they're filling the medication, that they're not having any side effects, and if they are, the social worker kind of reports that all back to a psychiatrist. It sounds really confusing as I sit here and talk about it, but the main goal is to provide behavioral health into the primary care setting that normally wouldn't be there, or that normally the PCP wouldn't have time to do. Um, my company, it's all virtual. There's this model, it's called the AIMS model of collaborative care. It's a really interesting read. It kind of further explains it maybe a little bit more better than I am. But I think it's kind of, it's been around for, they say, like 18 years, and it's had proven benefits. I know my company, their scores have shown that their PHQ-9 has gone down in 90% of patients. Their GAD-7 scores have gone down in 88% of patients. So we know it's working. I think it's just something that a lot of people maybe haven't heard of and might be hesitant to start. But that's a quick overview of collaborative care. I highly recommend if you're interested to look it up more. And that's it. Thank you.